This is the Upper Respiratory System Extra Credit Project by Alexis and Kendall. The functions of the respiratory system include supplying the body with oxygen and removing carbon dioxide. Processes of respiration include pulmonary ventilation, which is moving air in and out of the body, external respiration, which is oxygen from the lungs to the blood, and carbon dioxide from the blood to the lungs. Transport of respiratory gases is done via blood, moving oxygen and carbon dioxide in blood throughout the body. Internal respiration includes the exchange of oxygen from blood to tissues and the exchange of carbon dioxide from tissues to blood. Here are some structures of the upper respiratory system. The role of the upper respiratory system is to clean, moisten, and warm air, and also provide a pathway for oxygen to reach the lungs. External nose structures includes the bridge, which is the top, the apex, the tip, the ala, which is the edges, external nares or nostrils, and the phalangium, which is the grooves below the nose. The nasal cavity's function is the same as the upper respiratory system: clean, warm and moisten air, and it also houses olfactory bulbs for sense of smell. Structures within the nasal cavity include the vestibule, which is just above the nostrils, lined with skin, and vibrissae, which are hairs to catch dust and other particles. The nasal septum divides the nostrils. The nasal conchae include the superior, middle, and inferior, and they are the curves that swirl the air. The palate includes the soft and hard palate, the roof of the mouth, and floor of the nasal cavity, respectively. The uvula seals the nasal cavity when one swallows so that nothing goes through their nose, but sometimes that doesn't work, so we all seen that before. And the internal nares is the narrowing of the nasal cavity. The mucosa include the olfactory mucosa, which have smell receptors, and the respiratory mucosa that have ciliated pseudostratified columnar tissue. Here in the mucosa, we find lots of veins to warm air and nerve endings to respond to irritants like dust and other particles, so you can sneeze to expel them. The paranasal sinus's function is, like everything else, warm, moisten air, and issues that can happen here are rhinitis, which is runny nose, and sinusitis, which is a sinus headache. The pharynx contains three parts: naso, oro, and laryngopharynx. In the nasopharynx holds the pharyngeal tonsil or adenoids, which is lymph tissue that monitors for pathogens, the pharyngotympanic tube, which equalizes pressure, and the tubular tonsils, which go around these tubes and prevent infection. The lower respiratory system includes the larynx and the trachea. The larynx provides a way for the air to get to the lungs and keeps it open, and guides food to the esophagus and assists in voice production. A subfunction here is the Valsalva's maneuver, which is one tightens their abdomen to try and expel feces. Structures within this include the epiglottis, which covers the glottis, and cartilages. One of those cartilages is the thyroid cartilage, which is you can see in posterior view, and on that you can see the laryngeal prominence, which is commonly referred to as the Adam's apple. The cricoid cartilage is in posterior and continues around to the front, inferior to the thyroid cartilage. Finally, the arytenoid cartilage is the cartilage that anchors the vocal cords and changes pitch of voice. It's also in the posterior. The vocal cords are here as well, false and true, vestibular folds and vocal folds, respectively. The false vocal cords protect the true vocal cords, and the true vocal cords vibrate to form sound. Inflammation of the vocal cords is called laryngitis, and here the hole is called the glottis. The other structure of the upper respiratory system, the trachea, has three layers: adventitia, submucosa, and mucosa. The adventitia is the outer layer of dense, irregular connective tissue, And the submucosa contains mucus glands, and the mucosa contains goblet cells that produce mucus. Other structures include the C-rings of tracheal cartilages that keep the airway open, trachealis muscles that are used when you cough, and the carnea, which is where the trachea ends and bronchi begin. The bronchial tree starts with primary bronchi and then split into secondary bronchi, and then again into tertiary bronchi, which is about 20 more subdivisions. After that becomes bronchioles, which have no cartilage. Terminal bronchioles are the next subdivision. And then again, one more time, they split into respiratory bronchioles, which is where gas exchange happens. Alveolar ducts are passageways to alveolar sacs. Alveolar sacs contain the antrum, which is the entrance to the sac. Two types of cells are found here. Type 1 cells are simple squamous epithelium, which is good for gas exchange. And type 2 cells are also called septal cells that produce surfactant, which make the surface tension. The alveolar pores are passageways between the alveoli, and alveolar macrophages or dust cells are what keep trapping dust in your lungs so you don't get sick. Changes along the bronchial tree include decreased cartilage, epithelium gets thinner, and smooth muscle increases. In the lungs, they have layers just like every other organ, the visceral and parietal, and then within the cavity is the pleural fluid that reduces friction. Infection of the cavity is the pleural-C. The root is where the bronchi and vessels enter the lung. The hilum is where the root goes in, which is an indentation. The costal surface of the lungs is where the ribs touch the lungs. The apex is the top. The base is the bottom. The cardiac notch is on the left lung, which is where the heart sits. And each lobe has its own artery and bronchus. The smallest division of the lung is a lobule. Blood supply to the lungs carries deoxygenated blood from the right side of the heart to the left side. So the blood exits the right side of the heart into the pulmonary arteries, goes through the pulmonary capillary network, and then goes out through the pulmonary veins, oxygenated and ready for systemic circulation. In systemic circulation, bronchial arteries from the aorta travel to the capillaries around conducting passageways of the lungs, and then to bronchial veins, and then to pulmonary veins, and then start the process all over again. The respiratory system is innervated by the pulmonary plexus. The sympathetic nervous system dilate bronchioles, and the parasympathetic nervous system constrict bronchioles. And the mechanics of respiration, the pressures play a really key part here. Intrapleural pressure is pressure within the alveoli, and atmospheric pressure between phases of inspiration and expiration. Intrapleural pressure is pressure within the pleural cavity, and pressure here is negative due to lungs pulling away from the thoracic wall and pressure pulling the lungs toward the thoracic wall. This is what allows the lungs not to collapse. Also called the transpleural pressure, the difference between the intrapulmonary and intrapleural pressures. Pneumonia thorax is a puncture of this cavity, and that allows air to go into the cavity, and that collapses the lungs because it disrupts the pressure. Other respiratory muscles include the diaphragm, which expands the chest cavity, the intercostals, which aid in inhaling, and accessory muscles include the sternocleidomastoid and pectoralis minor.
Respiratory movements and influences. Eupnea is quiet breathing. Hyperpnea is forced breathing. Passageway resistance is determined by the size of the airway. Constriction and dilation of the smooth muscle of the bronchioles changes the lumen. In the parasympathetic nervous system, it's stimulated by irritants. In the sympathetic nervous system, it causes decreased resistance. Lung compliance is how easy it is for you to stretch your lungs. Lung elasticity is the less stretch and less compliance. Alveolar surface tension has to do with surfactant, which reduces the surface tension. Respiratory volumes and capacities. Respiratory volumes is how much air is moving in at one of the stages. Tidal volume is how much air you breathe in normally during doing nothing. Inspiration respiratory volume is how much you can breathe in after a tidal inhalation. Expiratory reserve is how much you can breathe out after a tidal exhalation. And residual volume is what's left after expiratory reserve and what's not getting out. Respiratory capacities are two or more volumes added together. Inspiratory capacity is a tidal exhalation to max inhalation. Vital capacity is breathing out as much as you can and then breathing in. Total lung capacity is your entire lung capacity. Dead space is where you don't do anything except for gas exchange. Anatomical dead space is in the trachea. Alveolar dead space is blocked alveoli, and total dead space is both anatomical and alveolar dead space added up. A spirometer is used to measure how much air is moving in and how much air is moving out. Alveolar ventilation rate is how much air can be moved out in a certain amount of time. And that is found with the respiratory rate times the total volume minus the dead space. Non-respiratory movements are coughing, sneezing, hiccups, and yawns. Gas exchange in the body. The gas laws are Dalton's law of partial pressure, which is gas pressure adds up. Henry's law, which is the higher concentration over the liquid force, moves gas into a solution. Hyperbaric conditions says that more oxygen in the blood puts more oxygen in the blood so you can heal faster. Composition of alveolar gas is less nitrogen and oxygen and more carbon dioxide and water. The external respiration is breathing in and out. And it is found with partial pressure, the thickness of the respiratory membrane, the surface area for gas exchange, ventilation and perfusion coupling, which is the vasoconstriction to slow down for more oxygen, and vasodilation for high oxygen levels. Internal respiration happens when capillary gas exchange happens in the body tissues. Transport of gases by blood. Oxygen transport is that 98.5% is carried by hemoglobin and 1.5% is dissolved in the plasma. The saturation is that 1 to 3 oxygen per hemoglobin Affinity is how tight the hemoglobin grabs onto the oxygen. Factors that influence it are partial pressure of oxygen, and if that goes up, the affinity goes up. The temperature, if that goes up, the affinity goes down. And the pH, if that goes down, then the affinity also goes down. If the partial pressure of the CO2 goes up, the affinity goes down. Impairment for CO2 transport. Hypoxia type is not getting enough oxygen to the tissues, and there are three types. Isosemic, which is blood circulation impaired. Anemic, which is not enough red blood cells. Hystoxic, which is body cells can't use oxygen. Hypoxemic is the reduced atrial oxygen because you're breathing air without oxygen, which can be caused by carbon monoxide poisoning. CO2 transport. CO2 is transported as a bicarbonate ion in plasma and is dissolved into the plasma. The Heidelin effect is less O2 means you can carry more CO2. The influence of CO2 on blood pH is that CO2 in the blood is acid, which means that it lowers the pH. Control of respirations. Neutral mechanisms, which are medullary response centers, pons respiratory centers, and reflexes. The receptors for the reflexes are nasal mucosa, which causes you to sneeze, tracheal and bronchi, which cause you to cough, and bronchioles, which constrict. Respiratory adjustments. If you exercise, you go into hypernia, which is deep rapid breathing, higher altitude, which lowers the partial pressure of oxygen, and you go into acclimation, which your body has to get used to the higher pressure. Clinical problems. You have COPD, which you have obstructive, and that is the permanent enlargement of the alveoli, chronic bronchitis, which is excess mucus production because of an ongoing infection, and tuberculosis. You also have lung cancers, and you have squamous cell carcinoma, which develops in the epithelium of the bronchi, adenocarcinoma, which spreads out around the lungs itself, and you also have small cell carcinoma, which is fast moving and aggressive. Thanks for watching.